Integrated Vaccination campaign on the 3rd of August, with one of its aims to prevent childhood diseases such as polio, diarrheal diseases, whooping cough, and others. Now, the National Vaccination Campaign will be coming to an end on the 19th of August. And to talk to us about the progress made thus far, we're joined in studio this evening by the Executive Director in the Ministry of Health and Social Services, Mr. Ben Nangombe. So good evening and welcome to the Daily Roundup.
Good evening, Nina. How are you?
I'm good. How are you doing?
I'm well. Thank you very much.
Thank you so much for your time this evening.
You're welcome.
To start with, perhaps you can just give us an overview and describe to us, the public's response to the campaign.
Yeah, perhaps I should start by stating a bit of background. This is an integrated national vaccination campaign, as you said in your opening remarks, aimed at preventing childhood illnesses. It also provides vaccination for example, women between the age of 19 and 49 years old, and also to provide for issues like the measurement of children to determine whether they are malnourished. It's not only vaccination, we also have to determine whether they are malnourished, and for us to have the appropriate interventions in that regard. So the campaign was launched by the Right Honourable Prime Minister, Dr. Saragu Madira, on the 3rd of August in Windhoek. It is being rolled out in all the regions around the country and in all 36 health districts around the country. We have deployed teams to more than 700 vaccination sites around the country, and as you indicated, providing this vaccination for childhood illnesses and also the COVID-19 vaccine. We have seen good progress in terms of the figures that are coming through from the regions, in terms of the targets that we have set for ourselves. The public response has been quite positive. We've seen support from the regional governors, from the traditional leaders, from the religious leaders, from the elected officials such as local and regional authority councillors, and members of the public generally. The campaign involves a whole continuum of stakeholders. Our development cooperation partners are in there, non-governmental organizations are in there, community-based organizations are in there, and everybody is really doing their part. And I think what we need to emphasize is that the reason for this campaign is because the nation will remember that with the COVID-19 pandemic outbreak, some of these services were disrupted. Because we have had since independence what is known as the extended program on immunization, where these vaccinations were provided to children in order to prevent childhood illnesses. With COVID-19, for the past 2 years, these interventions were interrupted. We have lost ground in a number of areas, and the idea is really to help us catch up and cover lost ground as far as childhood vaccination, immunization are concerned.
Right.
And we want to thank all the partners that have supported us in this regard.
Of course, you've set some targets for yourselves in terms of, figures that you'd like to reach with this campaign. Starting with some of those, statistics, let's talk about how many regions you've been able to reach thus far. Have you been on target with that? Let's start there.
Well, as I said, we are talking about vaccinating, for example, children for measles and rubella is a figure of more than 300,000. And as I indicated before, we have rolled out the campaign in all the 14 regions around the country. The teams going from house to house, for example, all fixed health facilities are providing vaccination around the country. So if a person goes to a clinic, if you go to a health center, if you go to a district hospital, if you go to a referral hospital, these services are available there. That is in addition to the outreach points and the house-to-house visits by teams who are participating in the vaccination. And that's where we are saying it's a national campaign. It's integrated in a sense that it's providing a whole spectrum of vaccination for both childhood illnesses and, as I indicated, some vaccination for women of childbearing age.
Have you encountered any challenges, the teams on the ground, since the campaign has started?
Well, I think the challenges that we can speak about relates to issues, for example, of you still have misinformation out there. You still have people who hold contrary views that perhaps vaccination is not good for the population. And some of these people are still continuing to spread this misinformation. But what we are saying is that the extended program on immunization has been implemented since Namibia's independence. These are programs that are uniform in all countries around the world. Wherever you go, childhood vaccination is provided. Why? Because prevention is better than cure. You know that, for example, diseases like polio have been eradicated because of vaccination. And you know what polio does to people. It causes physical disability. But because people were vaccinated, it was eliminated. We now know that people will not face that risk of becoming disabled because they were not vaccinated. So with measles and rubella and other childhood illnesses, as you pointed out, the diarrheal diseases that affect children at a young age will be something of the past, will allow children to grow up healthy, will allow children to go to school, and have a life that is free from disease, because a vaccinated nation is a nation that is healthy. Vaccinated children grow up to be healthier adults who do not place a burden on the provision of the public health care services.
You mentioned, of course, you're also not only focusing on children, but also on women of childbearing age. You mentioned the age from 19 to 49. There's also vaccinations, available for them. And then you also said that, you're also incorporating COVID-19 vaccines. Can these vaccines, cohabit safely? Is it safe to take, COVID-19 vaccine and whatever else is offered to these women?
According to the information that we have, it is safe to take both vaccines at the same time. Women of childbearing age are injected with the tetanus, and they can also receive the COVID-19 vaccine. We have, in fact, during this campaign, administered more than 10,000 doses, first-time doses of COVID-19 vaccine. I must say, are seeing a slow uptake of COVID-19 vaccine overall, even before the campaign and throughout the campaign. So this is something that we need to do more in order to ensure, because we don't know how the COVID-19 pandemic is going to evolve. We don't know what sort of new variants are going to come in future. And again, we must be prepared so that we don't find ourselves in a crisis mode where, for example, the healthcare facilities would be overwhelmed. And we cannot cope as we experienced, for example, in 2021. So the idea really, because we are saying of the 1,700,000 people that we want to vaccinate with COVID-19 vaccine, in order to reach 70% of that and therefore reach herd immunity. The idea is to have that kind of target reached, and therefore should turn out that new variants are going to come, we are better prepared. People are not going to fall severely ill. They will not find themselves in ICUs or losing their lives. So it's for us as a nation really to do our part. And as we have rolled back some of the regulation of the COVID-19 response, we are saying that it's important now for Namibian citizens to be able to take responsibility, personal responsibility, to protect themselves, to protect their families. And that's why we are urging families now, with respect to the vaccination campaign for the children and also the adults, to be able to do their part.
Mr. Nangombe, we are out of time. Just very briefly, your final remarks to the public.
No, it's just to say that, you know, the mission of the Ministry of Health and Social Services and the wish of the government is to provide quality healthcare services to the Namibian public. And when we engage in campaigns such as this one, we count on the support of the Namibian people so that we all give a hand to make this intervention successful and thereby protect the people of our country from illnesses that can cause death or disabilities.
Thank you so much, and thank you for joining us this evening.
You're most welcome.
That was Mr. Ben Nangombe speaking to us this evening on the Ministry of Health and Social Services Integrated Vaccination campaign that is kicked off and comes to an end this Friday. For parents that are still looking to where they can take their children to get vaccinated in the different regions, please do approach your local hospitals and clinics, and there are also teams on the ground from the ministry, so look out for them to get further information. We'll be right back after this.